I grew up in a medical family. My dad was a surgeon, and so I grew up watching surgeries in the bedroom so that he could learn a new surgery, because that was 60 years ago. And so I always just thought that was a really interesting helping job, helping profession. And I'm the only one of my sisters that entered the medical field, but I've never regretted it.
Her dad was a physician, and so he had that Hippocratic oath that you serve and take care of others, and that's always been the way she is, you know, and she's always there to help new nurses, new school nurses, help them to mentor, find scholarships, keep going, encouraging them. She's a great encourager as well.
So my grandmother was a lot like my mother, very outgoing, hardly could sit still, worked in the garden, but helped at the kids' school and helped with a lot of nonprofits, and she worked in the medical field too. When you're around other people that serve, you realize that that makes your life have purpose. You are giving back, you're not just taking. Sitting still is very, very hard for Charlotte. She is a doer. She sees a need and addresses it.
She is passionate but calm and put together. She can work on the floor with children in the underserved community, then go to a gala and hobnob with the rich and famous of Bakersfield.
I was diagnosed with breast cancer in 2006, and so I knew I was going to lose my hair with chemotherapy. So I went to Links for Life to get a wig, and I became so appreciative of the services that were offered there that when an opportunity presented itself, I was able to join the board.
Charlotte became an advocate for Links for Life because she knows what Links for Life does and how it's able to help breast cancer survivors. If a woman is facing hair loss or has just been diagnosed with breast cancer, she will come with them for a wig, or if she needs to come to the support group the first Tuesday of the month, she'll come with the woman who's been diagnosed to the support group and help them as they travel their journey of surviving breast cancer.
Links for Life has been extremely impactful, not just to the people that she's helped, but even to her. I mean, it's given her a purpose out of the struggle that she went through.
I think my mission there is to grow the outreach services, because given my background as a public health nurse and school nurse, I know the challenges in our massive county. And so growing those outreach services has been a passion, and then raising the funds to fund those services is a dual passion that I have. I had the unique opportunity to be on a multidisciplinary team when special education laws were brand new.
If the students aren't well, the staff's not well, nobody's going to learn in the school, and helping that to make a healthy community and a healthy world. And I think that's what Charlotte's been so good at, being able to advocate and teach us how to advocate for ourselves and for our students.
Healthy children learn better, and school nurses often make it happen, especially with children with special needs. And so transitioning that time when I was on the team to then becoming a school nurse at a site, I was able to see the challenges that come with each child. It was a new concept for the school districts as well as for the families. And so we certainly had some challenges in those days, but you know, I just loved that. Being a guest in someone's home, you were always there by their good graces, and you had to accept their culture, their home, their family, their dogs, and travel in those days without cell phones, without pagers even, was interesting.
When you see Charlotte, Charlotte is what you get. You know, she just really cares about people.
Charlotte's very, very loving and very involved.
She is grace under fire.
Charlotte is just a caring, really wants to make a difference, cares about others, cares about making lives of others better, especially children, but also women.
She's my biggest cheerleader.
Charlotte is an advocate for women and health and children, and she is passionate about our Kern County community, and we want to thank her for all she does.